Assalamu alaikum, the clinical day. Your role is the senior house officer in the GI clinic, gastro clinic. Scenario, Mr. John Adam, 45 years, referred to you after having hematemesis attack last night. Please sit with him, examine him, and address his concerns. Okay, if you're ready, Dr. Mahmoud.
Yes.
Okay, here you go.
Okay, good afternoon. I'm Dr. Musa, doctor in the clinic today. Let me confirm you. Can you confirm to me your name and age, please?
Yes, I am John Adam.
Nice to meet you, John. How would you like to call you? John?
John, doctor, yes, call me John.
Okay, John, we are here to discuss about your complaint. Is it okay with you?
Yeah, sure, doctor.
Okay, John, brought to my knowledge that you have throwing up blood. Could you tell me more
Yeah,
about this, please?
yeah, doctor, I'm sorry, doctor. When I saw this blood coming through my mouth, I was too much worried. It's scary, doctor.
I'm very sorry to hear about that. But John, when it started exactly?
Yesterday, doctor.
It is the first time to have this attack or any
Yes.
previous?
No,
Okay.
doctor, first time ever.
Okay, how frequency, how many times you have this throwing up blood?
Twice it happened.
When was last time?
It was 4 hours back.
Okay, what is the color of this blood? Is red color or
Yeah, bright red.
bright red? Any food with this blood?
No, doctor. I
Any
didn't eat.
any process with this blood, with this vomiting blood?
No,
Okay, John, do you have any tummy pain
no,
now?
doctor. I
Any,
have no
yes.
tummy pain, doctor. I have no tummy pain.
Okay, any tummy swelling?
Yes, I feel some discomfort, doctor.
Sorry for about that, Mr. John. Do you have any heartburn?
I feel, yes, sometimes heartburn.
Do you feel any acid brush on your mouth?
Yes, I feel it.
Okay. John, do you feel that anyone told you that you are better than before?
No, no.
Do you notice that you're any yellowish discoloration of the eyeball?
No, doctor. I didn't notice it.
What about your motion, your bowel motion, John? Any change?
Yeah, yes, it's little hard, doctor.
What is the color? It is black tea color or
No,
red color?
no, I didn't see this black before, doctor. It's normal color.
So it is hard stool.
Yes.
Okay. Any bleeding before from back passage?
No,
Any black tea stool before?
no, doctor.
John, do you have any shortness of breath now?
No, I'm fine, doctor.
Any dizziness? You feel dizzy?
No,
Any racing heart?
no.
Okay, John, do you have any long-standing disease? Should be aware.
I am diabetic, doctor.
For how long you have diabetes?
For almost 10 years now.
10 years. Can I know what's your medication?
I'm taking tablets. It's called glycoside.
Okay. So you are compliant on this medication?
Yes,
Did you measure your blood level last 3 months, which is hemoglobin
yes.
A1C?
Yeah, doctor. It was 7.5.
Okay, John, do you follow up with your eye doctor?
Yes, doctor, frequently. Yes, I am
Okay,
visiting.
any change in route or work
Um,
amount or frequency?
it's more, as you know, doctor, the diabetic.
Okay, any fluid urine?
Sometimes, yes, there's porphyris.
Uh, okay, John, do you feel any pain and needles in your hand or your leg?
No,
Okay, John, just do you smoke?
I quit smoking, doctor. I was smoker before.
when you are quit smoke?
When I had heart attack,
Oh, sorry for that, Mr. John. When was this heart attack?
it was 6 months back.
6 months back. What is the medication you are on now?
I'm on medication called aspirin.
Okay, John. Do you know the dose? Any change in the dose of this
No, the
aspirin?
same, doctor. No,
Okay. Any stroke? Any history of stroke or mini
no,
stroke?
no.
Okay, John. Can I ask a private question if you don't mind? Do you
Yes.
have any problem in your intimate relationship?
Yeah, doctor, it's weaker than before.
Did you seek any medical advice?
I asked friends and they told me about some tablet, blue one.
Yes. Okay, John. Any long-standing disease other than diabetes and heart attack?
No.
Can I know what's your drug list?
Medication list?
Drug list.
Yeah. It's medication list. Okay, medication list.
Medication list.
Yeah. Glycoside, aspirin, and paracetamol, and morphine.
And what? Sorry?
Morphine.
Morphine. Okay. For what do you take paracetamol and morphine?
Sometimes, doctor, I feel knee pain.
Okay. Which knee? The right knee or left knee or both?
Both, doctor. Yeah, both.
Any morning stiffness since it's knee pain?
No,
Okay. How much you breathe this pain? 1 is minimum and 10 is maximum.
4 to 3.
Sorry for that, Mr. John.
Thank you.
Mr. John, did you notice this joint pain increase with exertion?
No,
No. Okay. What? Okay, John. John, going back to throwing up blood, is it any preceding cough before vomiting of blood?
no,
Okay. Do you have any increased body temperature?
no,
Any lose weight or weight change?
no,
Any lumps or bumps in your body?
no,
Okay, John. Do you have any back pain?
no,
Do you have any history of these spells? Sorry to confirm.
no,
Any user preference?
no,
Okay. Do you have any bleeding from other orifice?
no.
Okay, John. John, what do you do for a living, John?
I am a taxi driver.
So this throwing up impacting your symptom impacting your job?
Although it started only once and it happened once, but still I'm worried, doctor. I feel something wrong, doctor, with me.
Yes. Sorry for that, Mr. John. John, do you have any user preference?
No, doctor, you asked me.
Yes, ask you. Sorry. Any skin changes? Any rash in your
Yes,
body? Where is the rash exactly?
in my face, doctor, I feel change in my face color. Sorry?
Sorry, this rash increase with sun exposure?
Sorry? Again?
This rash increase with sun exposure?
No, it's not the sun exposure.
It doesn't relate to sun exposure.
No.
Okay, John. John, can I ask you what's your mood, please?
Yes, doctor, yes. Ask.
What's your mood?
It's okay, doctor, apart from worried.
Sorry?
Worried only, I'm worried.
Worried. Sorry for that, Mr. John. We hope I help you after the discussion. John, do you have any cough?
No.
Okay, any picture of this rash, Dr. Basil?
No, I don't have it.
Hello?
No, Dr. Mahmoud, I don't have photo. Sorry.
You don't have
Continue.
a picture. Okay. Okay, John, do you have any itching?
Itching? No, doctor, it's not.
Okay. Do you have any pins and needles in your hand or feet? Sorry, just to confirm that. Sorry.
No.
Okay. Okay, John. Can I examine you, please?
Yeah, sure, please.
Okay, first I'll examine the hand for any
Yes.
colinekia, any clubbing.
No clubbing, no leukonychia.
Then I will examine the pulse and the blood pressure sitting and standing.
Yeah, pulse is 80. Blood pressure, no change in sitting and standing.
Okay, then I examine for proximal myopathy.
Proximal myopathy, no proximal myopathy.
No proximal myopathy. Then I will examine the mouse.
Or
Inside the mouse.
nothing in
Or
the mouth now.
nothing inside the mouse, and for central cyanosis and the eye for pallor and jaundice.
Perfect.
Is there is
No,
any pallor?
no color, no jaundice.
No pallor, no jaundice. Okay, then I will examine the chest for any wheezes or fine basic
No,
crepitation.
no wheezes, no fine
I
basic tremors.
examine the heart for any tachycardia.
No tachycardia. Heart rate was 80. Apex in place.
Okay,
And no murmur.
and remember. Okay, then examine the abdomen. If you had any pain, Mr. John, in your abdomen.
No specific pain, no tenderness. Now you can examine.
Okay, now examine. Okay, I will examine superficial palpation for any masses.
Perfect. No masses.
Okay, then
No superficial mass. Okay, then.
I'll examine the heart, deep palpation with the heart if there is any hepatomegaly.
Heart,
Sorry,
hepatomegaly.
the liver. Sorry, hepatomegaly, liver.
Okay. Yes, there is hepatomegaly 2 centimeters below the costal margin.
2 centimeter.
Yes. Two
Okay,
fingers, sorry, 2 fingers.
2 finger.
Mhm.
Okay. Okay, then I will examine the spleen.
Spleen,
For
palpable,
spleen,
yes.
palpable also.
2 finger, yes, below the costal margin.
2 finger, okay. Then I will examine the lower limb for any lower limb edema. And
Okay, still you are in the abdomen. Be systematic. Now,
yes, ascites.
spleen and liver.
Ascites. Yes,
Okay,
ascites.
perfect. No
Ascites.
aside.
Okay, then I will go down to the joint. He has joint
Okay.
pain.
Yes, and the knee there is some crepitus.
This crepitus. Any redness or hotness?
No redness, nothing.
Okay, the range of movement.
He can, no limitation.
No limitation. Okay, then lower limb.
Yeah, no edema.
Okay. Okay, so John, do
2
you have any
minutes
family?
left.
Do you have any family history of gland problem or anything?
No, doctor. Gland, no gland problem in my family.
Any blood problem?
No blood problem.
Okay, John. John,
But
can
my
I?
father has or had liver disease, doctor.
Okay, sorry for that. Okay, John, what's your? Can I know? Can I know what's your concern, John?
Doctor, I'm worried, doctor. Is it like my father? Is it cancer in the liver?
I really appreciate your concern, John. Really, your concern is valid, but according after this discussion, I have a lot of possibility. One of them is a familial disease which runs in the family, leads to accumulate special material in your joint and also in your glands. And also there is another possibility of the drug that you have taken. So what will we do? We will admit you, and will we do some investigation and after that we will have another meeting to discuss about your result.
Okay.
Sorry, John, we will not admit you. Sorry.
Doctor, what diagnosis in the family? You told me about something in the family. What do you mean by that?
Yes, John, it is a familial disease it is a familial disease runs in family called hemochromatosis. I think your diabetes and your joint pain is a part of this disease. So we have
Okay,
to
will
be.
my kids have this disease, doctor?
I think, Mr. John, your kids have 50% to have this disease.
50. Okay,
Yes.
time's up. Okay, present your case.
Okay, Mr. John, 45 years old, present to me. He has hematemesis, 2 attacks last day. It was fresh red color. Mr. John, he has diabetes, plus also he have joint pain, and also he has rash in his face. And he has problem in his he has impotence, a problem in his intimate relationship. So my first differential diagnosis will be hemochromatosis, and also Mr. John taking painkiller for his joint pain. So it may be also drug induced, maybe peptic ulcer or other thing.
Now you give me 2 differential. Peptic ulcer
Yes.
disease and hemochromatosis. What else?
What else? Really, I was thinking about maybe sarcoidosis, but he has no
Why?
chest problem. He has increased water work and constipation.
Okay.
Okay.
What else?
It is in the bottom of my differential diagnosis,
Okay,
sarcoidosis.
good. Okay.
But third, it will be maybe non-alcoholic hepatitis, maybe associated with his diabetes.
Okay. Okay. Did you ask about alcohol intake?
No.
Okay.
Yes.
Okay. If this patient alcoholic, what question you want to ask him? And what history you want to take?
Yes, maybe this hematemesis due to alcohol intake. It may be preceded by prolonged coughing. But I asked him this question, but he told me no.
What condition this one?
Mallory syndrome.
Okay. Did you ask about binge drinking alcohol?
No.
Okay. How to investigate?
Yes, first I will do urgent CBC to this patient to see if there is any hemoglobin drop, and also liver function test and kidney function test and inflammatory markers. I will. Hello?
Yes, I can hear you.
Okay.
Go ahead.
Okay, I will do ultrasound on his liver, and for hemochromatosis, I will do ferritin. It will be more than 1,000, and also transferritin saturation, more diagnostic if more than 60. And also I will do alpha fetoprotein. And for non-alcoholic hepatitis, I will do free fatty full cholesterol and HDL and LDL, and triglyceride level, and also I will do hemoglobin A1C for this patient. And if we need, if our diagnosis is Mallory syndrome, I will also do only CBC. No need for admission or other investigation, just to observe and discharge the patient and follow up in the clinic. Okay.
How to manage this patient?
Yes, this patient after taking CBC, if the patient is hemochromatosis, it will be first by multidisciplinary team, by non-pharmacological patient education counseling, stop alcohol if he take alcohol, and also vaccination against hepatitis B virus. I would refer the patient to gut doctor and internal medicine.
Why gastro-referral here is important? What you
If
suspect?
yes, if the patient is hemochromatosis,
So
yes, it will be for pharmacological. It will be by phlebotomy or dysphyrox.
it's fixable. Okay, this is by hematology.
Yes, it's
Okay,
hematology.
I'm asking about gastro. Will you proceed for any procedure here
Mallory syndrome.
or hemochromatosis?
Mallory syndrome, no, I will not do any upper GI.
Okay.
Just for
If you
observation.
suspect hemochromatosis
Yes,
for long term,
liver. Yes, liver biopsy.
and for the gastro, any invasive procedure?
Hemochromatosis phlebotomy.
No.
Treatment.
Patient with hematemesis and
Yes,
that
upper GI. Yes.
okay, okay. Fair enough. Okay, thank you, Dr. Mahmoud.
Thank you, Dr. Bess.
I don't know why you are depressed. You are close to the exam and your mood is low. I know
Yes,
it's
really,
stress.
I have this,
No, no.
no severe headache,
Yes, you
Dr.
are.
Basim. I have severe
It's
headache.
obvious. Yes, obvious.
Hello?
Solid. Hey, Dr. Mahmoud. Sorry for I'm on duty. That's why some interruption today. Okay.
Take your time, Dr. Basim, no problem.
Okay, for your performance, what do you think? What you missed and
Yes,
how you
alcohol.
missed? Yeah, how do you
Yes.
miss? You ask, I always say when you ask for smoking, ask for alcohol. Do you smoke? Do you drink alcohol?
Maybe I forget. I write it in my paper. Really, Dr. Basim.
I know, I believe, but the
Right.
examiner, it's no excuse the examiner. Even you will show
Yes.
him the paper, he will not respect.
Mhm.
He will ignore all these things. He doesn't care. What he care about, what you ask and what you mention. So abdominal pain and abdominal discomfort, GI bleeding, alcohol is a must. And not only alcohol, you have to ask for cage if he is alcoholic. You
Yes.
have to know if this patient alcoholic. And you
Mm.
might put in your differential alcoholic liver disease.
Mm.
Plus Mallory West, if he drank yesterday or binge drinking, he was his friends and they were celebrating whatever they do or whatever they did. And today or yesterday he had vomiting of blood. You might put Mallory West, you put it blindly, but it might be the case. So take care.
Mm.
And the examination, you miss the whole chronic liver disease stigmata. Even it's not there, you have to ask about. Expose the chest from the back and the front, caput medusa, right? Spider nevi.
Yes.
Yeah, the spider nevi in the abdomen, sorry. Uh, Spider nevi in the chest at the back or the front, you have to ask about gynecomastia, axillary hair, lymph node. What happened? You miss a lot of things.
Yes.
And this is not, I brought this case for two stations. You have gastro or abdomen as short, and it might come as long. I know it might be easy for some of us, but it's a complicated one. Dr. Marwa wrote the diagnosis earlier, but I said no, just to distract you, because if you focus on the diagnosis, you will know the case. But it's, yes, it's hemochromatosis with cirrhotic liver disease or Mallory-Weiss or alcoholic complication or alcoholic liver disease. But you have to know all this differential. I put it as case for differential: alcoholic, Mallory-Weiss, hemochromatosis, chronic liver disease, even hepatocellular carcinoma. You don't know. You ask about the weight, about the appetite.
Yes.
No, but
Yes. No,
appetite,
sure.
I think you didn't ask.
No, I think
He asked.
I didn't remember.
Okay. He asked about the weight, Dr. Azhar, but the appetite he didn't.
Yes,
Okay.
I asked about the weight, not the appetite. Yes.
Okay. Family history, you ask any gland, any what else? Gland and what?
Blood disease.
And
I
blood.
think.
Why you are specifying the question? Okay, ask a specific question and open the question. First question, any gland, any liver. Okay, I will not tell you if you ask me about gland. Then open it. Any family history of note or any family history of condition or should be aware of or any disease. Or you can specify the liver. Your case about the liver. Why you missed the liver? Why you skipped the liver? You didn't
Yes.
ask about it at all. Okay, I have my father with hemochromatosis, or I have my father with liver disease. It might be hemochromatosis with complicated with hepatocellular carcinoma, right? It's one of the complication. You didn't ask. Okay, and how much the percentage? What the mode of hemochromatosis? Inheritance.
Autosomal dominant?
Is it?
I think recessive, yes. Yes, Dr.
Yes,
Basim. It is the only recessive and FMF. Yes.
So it's 25%. Hemochromatosis, I don't believe that you missed this topic, which is a very big topic in PACES. Hemochromatosis with complication, hemochromatosis with investigation, management. I ask you for screening. You give me liver biopsy before endoscopy. Focus, please, Mahmoud. It's
Yes.
2 days or 1 day. I
2 days.
prefer not to read anything tomorrow and after tomorrow, or at least the day before the exam. Yeah, 2 days. So what you have to do, just relax, don't be stressed. You did whatever, and you have to focus about your performance. You have to be calm during exam. You have to be confident. I feel today you are stressed, anxious, depressed, I don't know, but you are doing very well. Don't come at the end and to make everything nothing. Okay?
Okay, Dr. Basim.
Yes, all causes, Dr. Marwa said, all causes of cirrhosis should be excluded. Okay, so liver biopsy at the test or as examination or as investigation, it's at the end after finishing all non-invasive. Then the invasive, I mean endoscopy, ultrasound. You didn't do ultrasound, or you did? You ordered for ultrasound?
I think it did, yes.
Okay, ultrasound, I'm doing fibro scan, ascites, complication, liver, spleen. Okay, I don't want to judge. I give you mark in this station. Really, you miss a lot of things. I don't know, maybe, yes, I think you are not focusing.
Really, today I have severe headache, Doctor. Severe headache. You know, the back.
Yes, it's stressful.
Yes,
And less sleep. You have to sleep well. I'm trying to give you cases with a lot of findings just to focus what you have to examine. And I will give you advice. Whenever you have something positive in the history, put it in a circle beside word of examination, examination, AX, if you don't have time to write, because 5 minutes is not enough to write all the scheme and examine. Write EX, abbreviation for examination. And what you picked up in the history as positive for complaint, I mean abdominal discomfort. Write in your paper abdomen. You have to do abdomen examination, full abdominal examination. If you picked up this patient is chronic liver disease suspicious of, so there, this patient suspicious of chronic liver disease. He has diabetes, he has all features of hemochromatosis, bronze skin. I didn't give you the photo, but it's bronze skin, okay? Tanned or bronze. I will not tell you tanned because if you know the bronze skin, you will know the case. But I want you to think about everything. You missed the alcohol. Anyway, Write in this circle X before going inside the station, and under EX, whatever you picked up in the history, you have to examine. Here, you have to examine abdomen, full abdominal examination. Then another chronic liver disease, CLD. What CLD feature you know, and you have to examine? From hand,
From
yeah,
hand,
tell me now, from the hand.
yes, from the hand, pulmonary edema, debilitating contraction, clubbing,
Okay, excellent.
clubbing, and yes, and pulse, blood pressure, and
No, before pulse and blood pressure, wait, please. I'm
okay,
always reminding you this.
debilitating
Ex-
contraction, erythema, clubbing.
Extend the hand. Extend the
Yes,
hand.
yes, tremors and flapping tremors. Yes.
Yes, fine and flapping tremors.
Yes.
Okay, then
Please remember A, B, C, D, E. A, asphyxias, B, bruises, C, clubbing, D, dupuytren's contracture, E for Palmer erythema.
Mm.
A, B, C, D,
Yes.
E. This way you will never forget. A, asphyxias, B, bruises, C, clubbing, D, dupuytren's contracture, E, Palmer erythema.
Yes, Dr. Azar.
and this is the
Fine.
steps of abdominal examination. But I brought it as long, so it's the same steps. Okay, go as Dr. Azhar said, also bruises. You miss the bruises at the back or the dorsum at the forearm. Okay, go up in the face.
Okay, in the face, I examine the bladder and jaundice, and
Okay, good.
and then central cyanosis,
Okay, what inside the
and
mouth?
central cyanosis and any sores,
Yes, exactly, swords. Okay,
and
okay,
then
and in the face?
and the
Wait,
face,
it's still in the face.
lymph nodes.
No, in the face. Alcoholic.
Yes, parotid enlargement.
Yes, parotitis. Okay, okay.
And
Now the
then
neck. And don't forget the skin for bones skin.
yes, the neck lymph node.
Lymph node. Okay, what else?
GVB.
Okay, now in the chest.
The chest is gynecomastia
Perfect.
or spear's hair,
Yes.
spider nevi.
Okay.
Yes,
Front and back. Okay.
okay. And then the abdomen, palpation,
Okay.
then deep percussion,
If
deep
I ask
palpation,
you,
sorry.
no, the abdomen, the chest and heart examination. What you want to examine in one step?
Chest and heart.
Heart examination. What heart examination you can do?
Basal chest and heart, yes, B2, pulmonary
Heart
hypertension.
only. No, not pulmonary hypertension. Heart.
By basal crepitation.
Okay. Apex. Yes, apex. Hemochromatosis as infiltrative.
Yes.
Okay. Heart
Yes.
might be affected. Okay. You go to the abdomen.
Yes, then the abdomen, I will do superficial palpation, and then deep
All the steps.
palpation. Yes, deep
Yes.
palpation, liver and spleen and kidney, and
Okay.
then auscultation if there is any mass
Okay.
or any hepatomegaly, and then before auscultation the kidney and
before the
and
auscultation.
yes, and the ascites.
Yes. Perfect. Okay. If you have splenomegaly, how you do the ascites?
If I had splenomegaly, I go, I tell the patient to move into the left lateral position.
Perfect. Yes. Don't miss this point. And this is also the abdominal station.
Can you
Whenever
repeat?
you are left lateral, yes.
What did you ask? If the splenomegaly, what did you ask?
If there is splenomegaly, how you can ask for shifting dullness?
Right lateral.
No. If there is splenomegaly, you
Yeah,
can.
right lateral, just to check the ascites and bimanual examination of the spleen. So you will ask the patient to come on his right side.
But if there is splenomegaly, I can't do shifting dullness to the left while the patient on the right. So I will ask the patient to move to the other side, left
Okay.
lateral. because the spleen will mask the ascites because you move the fluid toward the spleen, right? The spleen will mask your ascites finding. It will be dullness again. So better to move him to the left lateral and to do the shifting dullness in the right side. You got it,
Yes, good.
Dr. Mahmoud?
Yes, Dr. Basim. Yes, I know. Yes.
Okay. What else after you finish abdomen and offer
Yes.
inguinal lymph node? What else you have to offer in this patient particularly? When you ask about?
Yes, fundus examination.
No. Still in the abdomen. Don't go up again.
Still in the abdomen. In patient with hemochromatosis, Dr. Basim?
With upper GI bleeding, hematemesis.
Yes, digital rectal examination.
Excellent. Yes, you have to offer it. Even he denied any melena or back passage blood, fresh blood or whatever. Okay. Then the knees, hemochromatosis as pseudogout and for leg edema for failure, heart or liver failure. Okay.
Doctor.
Focus.
Can we also, I want to, there may be testicular atrophy in chronic liver disease. Can we
Yes,
also?
he can offer the genitalia. That's why he has also impotence. You can correlate it with this testicular atrophy. Okay?
Dr. Basim. Yes, okay.
Clear? I hope also this case will come to you either in the long or short. But please focus. Remind or try to put in your scheme while you are sitting alone what steps I will follow in every patient. From since you enter till you get out. Imagine, okay? And remind yourself what point I should do in every patient. Don't read, just do this and train yourself how to present and try to say the positive finding. Sometimes the examiner will ask you, give me the positive finding. I don't want you to tell me I found pulse, I found apex. No, he will ask you, he might disturb you by this. You start to present the patient. I examine Mr. He is 40. First question he will tell you, doctor, please give me the positive finding. When he tell you this, you will be more panic and you will forget everything. Some of the examiner like this. So what you have to do for me, I will ask him, you want the positive finding, or you can start by positive finding. But in the systematic way also. Positive finding in the pulse, positive finding in the apex. Here, this patient, positive finding in the hand, leukonychia, colonychia, tremors, jaundice, abdomen exam. Try to mention only the positive. Don't tell him the steps of examination. Okay? They don't prefer to mention everything. Try to bring and to tell him the positive finding. Okay. Thank you, Dr. Mahmoud. I don't want to stress on you more, but yeah, please.
Very nice case, Dr. Basim. Very nice case. Very nice case. And you explain each and everything very well.
I'm trying really to give him some cases. It might come. It's common, and he should do all these things with. That's why I focus. Yes, not the.
We will have these two cases. This
I hope, wallahi, I hope.
ankylosing spondylitis.
Inshallah, Dr. Azhar. Inshallah.
Inshallah.
Thanks.
But don't forget A, B, C, D, E in hand. Don't forget. It will be easy for you.
Okay.
I will write in the chat box after this. Inshallah, I will write.
Okay.
Don't forget the numbers of ferritin, transferrin, target after phlebotomy. Okay.
What is the target for phlebotomy, Dr. Basim? 20.
Yes.
250, I think.
50.
50
less than. No. Transferrin less than 50%.
Target, yes. The target in phlebotomy, yes.
Yes. Okay, and what the ferritin level? As investigation.
Less than 500, I think.
No, there is male and female.
Female 50 and male 60, I think.
This is what, the transferrin?
Yes.
No, ferritin.
Ferritin more than 1,000.
No. Anyone knows?
The target after blood after
No,
phlebotomy, Dr. Pedro.
no, screening. You are doing screening.
Screening.
300 in the male and 200 in the female.
Yes.
Again, Dr.
Not,
Target
no, target.
transference.
I'm asking what diagnostic ferritin?
300 in the male and 200 in the female.
Yeah, I
And
think
the
Dr. Mahmoud
aim
list
after that, the phlebotomy is to make it between 50 and 100.
This is the transferrin.
No. The ferritin itself, the diagnostic for hemochromatosis in male will be 300, and in the female, if it is above 200. After
Yes.
that, you will do venesection to take blood from the patient. Frequent
the target-
venesection weekly and in the every other day, I think, and your aim
No.
to keep the ferritin below 100, so between 100 and 50.
The target will be transferrin.
No, the transferrin saturation is 50%.
Yes, less than 50. But no target in the ferritin. It's a target in the transferrin.
No, there is target also in the ferritin.
Oh, I remember only the transferrin less than 50%. Okay, go ahead. But as the doctor said, the ferritin in male 300, in female 200.
Excuse me,
This is
Dr.
for the
Bas.
investigation. For investigation, Dr. Mahmoud. I mixed the question. Target for phlebotomy, transferrin less than 50. But what the investigation you will do? Start the specific investigation for hemochromatosis, ferritin level.
and transferrin.
Yes, in the male more than female, 300 in the male, 200 in female.
Transferrin, Dr. Basim, it is percentage.
Yes,
Yeah.
percentage.
60%.
More
Yes.
than, you mean as a diagnosis? No, I asked a question early for the target transferrin after phlebotomy. Yes, you mentioned it less than 50.
50 in female and 60 in males.
This is the target. Yes, I think the same number in both gender, less than 50.
I think for diagnosis, transferrin more than 60 in males. Transferrin, yes.
Okay, I will share it to the group numbers because we always forget these numbers. Okay.
Dr.
Any
Basim,
question?
your voice is very
Yes.
low today. What is the problem
Really?
with your mic?
The problem, I'm on duty and I use my earbuds. Yeah, that's why I can't do. If I use the speaker, it will be more noisy. I use the earbud.
Yes.
Sorry for that.
Dr. Basim, in the management regarding the hemochromatosis should be keep serum ferritin less than 50 microgram per liter and
Yes.
transferrin saturation less than 50.
Okay.
And as you said, in this case, alcohol should be stopped because the two ways. It may
Totally,
cause liver
yes.
damage, maybe increase ion absorption by down regulation of hepcidin from the intestine. That increase ion absorption. Alcohol should be stopped if patient has a differential diagnosis and it increase the ion absorption. And advise the patient do not eat any uncooked fish or shellfish because they contain bacteria lovely to grow in the ion in the ion. So advise patient to stop alcohol and advise to not eat any uncooked fish and shellfish.
Perfect. Thank you, Dr. Abdullah.
Rahman.
Abdulrahman. Thank you, Dr. Abdulrahman. Any comment, Dr. Azhar, you want to add?
No.
Dr. Ahmed, anyone, please feel free to
No,
comment.
just
less than 50.
Yeah, there's some confusion. So
Yes, go
this
ahead.
is screening, not diagnosis. So screening will be ferritin level and transferrin saturation.
Yeah, this is for screening.
If positive, proceed on and diagnostic tools. Targets for venesection, transferrin saturation less than 50%.
Yes.
And what is the target for ferritin?
I don't remember target for ferritin, but
لا
some
50
doctor
50 مايكروجرام بالليتر فريتين
50.
50 مايكروجرام بالليتر 50.
Okay.
Okay. Any question, any comment before moving to the next scenario? Dr. Mahmoud, send the scenario, please.
Yes, Dr. Bassem. What scenario? Dr. Bassem.
Okay. Mr. Sami, 35 years, completed palpitation this morning. Please discuss, address the concern. Okay, let's start.
Okay.
Hello, I am Dr. Mukhtar in the clinic today. You must be Mr. Sami.
Yes, doctor. I'm Mr. Sam. Yes.
You are 35 years.
Yes, doctor.
We are here to examine you and to address your concern.
Sure, doctor.
Can you tell me about your complaint?
Yes, doctor. I have woke up in the morning today with dizziness, feeling dizzy and shortness of breath. I feel my heart racing. So I am very anxious about that, doctor.
I'm so sorry to hear about that. Can you tell me when exactly started this feeling?
Yes, in the morning, doctor, when I wake up.
It's the first time ever.
No, it is the third time. It happened.
Third time.
Yes, doctor. It happened before 2 times.
And when exactly these 2 times?
I think one since 2 weeks, and the first attack since 1 month.
Did you take any medical, or did you seek any medical advice?
No, doctor, because it lasts only for 1 hour, 2 hours, so I didn't seek any medical advice.
Any position, or particular position coming with this?
No, doctor.
Okay, and anything you feel increase or?
No, doctor. Just I woke up in the morning with this heart racing and dizziness. I afraid to have any heart attack, doctor.
Okay, did you have any chest pain with it?
Yes, I think, doctor. Yes, you are right.
And this pain exactly where?
All over my chest, doctor.
And what the nature of the chest pain?
I think it is dull aching, doctor, like that.
And do you notice something can improve this chest pain?
No, doctor. Chest pain comes with the attack, and ends with that when the attack ends.
The same time or and the same duration and the same frequency?
Yes,
3
doctor.
times.
Yes, doctor.
Okay, this just going chest pain going anywhere?
No.
Okay, if I give you scale from 0, no pain, and 10 is maximum, how can you scale this pain?
Yes, doctor. I think it's 3 or 4.
3 or 4. Okay. You told me it's not going anywhere, and it's the middle of the chest or all over the chest?
All over the chest, doctor. Yes.
Okay. You feel any acid rush with it?
No. No, doctor.
Okay. And you told me about the chest pain. You feel any short of breath?
Yes, doctor. I also feel shortness of breath.
The same attack or before?
Yes, in the same attack. Yes.
Okay. What you were doing before this attack? You are doing exercise
No, I was sleeping.
during sleep.
During sleep, yes. I woke up with this racing heart and the dizziness. I feel
And how this?
fatigued.
Okay. And how
Yes.
this attack end?
By herself, doctor.
Without rest?
Without any rest. No.
Okay. Do you feel sweating the same
No.
during the attack? Sweating. So
No, I didn't think so,
no
doctor.
sweating. And any headache during that attack?
Headache, no.
Any shakiness during the attack?
Any sickness, no.
Okay. You told me about short of breath. Can you explain more about the short of breath?
Yes, doctor. I feel my heart racing, and then I feel dizzy.
You feel dizzy also. Okay.
Yes.
Okay. And do you sleep on How many pillows you are sleeping during night?
Yes, I think one pillow.
Oh, and did you wake up at night gasping for
No, no,
searching
doctor.
for no.
No, doctor, never.
Any leg swelling?
No.
Any cough?
Any cough? No.
Any coughing up of blood?
No, doctor.
Okay, you told me about dizziness. The same during the attack?
Yes, doctor. It's the same time.
Is it with standing from sitting?
No, doctor, no.
Okay, anyone told you are paler than before?
No.
Okay. Do you have any medical condition I should be aware of?
No, doctor, never.
Any surgery before?
No, doctor.
Any allergy to any medication?
No, doctor, no.
Any herbal remedies?
No.
Okay. Show me your medication list.
I didn't take any medication, doctor.
Nothing. Okay, good. Mr. Rami, I will ask you some questions. It looks sometimes not relevant, but it helps us. Do you have headache?
Headache? No, doctor.
You didn't have headache. Okay. Any blurring of vision?
No, doctor.
Any balance problem?
Any? Sorry?
Balance or unsteadiness?
No, doctor, no.
Nothing. Okay. You have any intolerance to any weather?
No, doctor, never.
Okay. Any pins and needles?
No, doctor.
Sensation?
No, doctor.
Any weakness?
Weakness? No.
Okay. Any mouth sores?
No.
Okay. You have any abdominal or tummy discomfort?
No, doctor.
Any tummy pain?
No.
Any change of your bowel habit?
No, doctor.
Any change of your water work?
No.
Okay. Any back pain?
No.
You have any skin change or
No.
rash?
No,
Any
doctor.
joint pain?
No.
Any family history of same condition?
I think, doctor, my father have heart attack. Yes. He's on.
At what age?
Now when he was had the heart attack, he was 70.
And how is he now?
Okay, on medication, go on, no problem.
Okay. And any family history of other condition apart from your father and heart attack?
No, doctor, I don't think so.
Okay. Any travel recently
Travel? No, doctor.
or before?
No, doctor.
Okay. And you have partner?
Yes, doctor.
You have any casual relationships?
No, doctor, no, never.
Any problem, sorry for this question, any problem in your intimacy?
No, doctor, no. It's
Are
okay.
you using any recreational drugs?
Never, doctor.
Sharing needles,
No, doctor, never.
tattooing or piercing?
No, doctor.
Okay. You told me you don't have any problem with your intimacy, right?
No, doctor.
Okay. Do you smoke?
Yes, doctor.
How many for how long?
I think 2 cigarettes per day.
Okay. And do you drink alcohol?
Yes, doctor.
How many?
Occasional in the weekend.
Okay. So for the smoking, it's harmful in any amount to your heart and it carry risks. So I can strongly advise you to stop them. Is that okay for you?
Okay, doctor, sure.
Okay. What's your job
I am sales manager.
and how that impacting on your job?
No impaction, doctor. Just the attack come in the morning and ends after 1 hour, so no impaction in my job.
Okay. Can you tell me about the feeling of heartbeats? Is it fast or slow?
No, doctor, this is fast.
Fast. And is it like the clock?
No,
Regular?
doctor, I think it is irregular.
It's not. Okay.
Yes.
Okay. Do you drive?
Yes, doctor.
Okay. I think it's not affecting your driving this issue.
Okay, it's my job, doctor. I'm sales. I working in sales.
Okay, but no effect on your driving. I mean, you
No
didn't have.
effect. It's come in the morning and ends after 1 hour, so no
Okay.
effect.
Did you fall down or faint?
No, doctor, never.
Never. Okay. Any trauma?
No.
Okay. Can I examine you?
Sure, doctor.
Okay. Now I will start by the general look and surrounding. Anything around?
No, doctor.
Okay, I will examine you now. If you feel any pain, let me know, or discomfort.
Okay.
The look, how is the patient look?
Good.
Okay, so he's not,
Alright.
he's average weight. Okay.
Average weight, yes.
Okay, I will ask to examine the hands now for any pallor or
Pallor in the hand?
yes.
No, no.
Okay, I will examine the
Clinic.
pulse.
Pulse normal? Normal now.
Pulse normal.
Yes.
Equal both sides. Any
Equal?
delay?
No delay.
Radial?
No delay.
And the pulse character, okay, regular. And pulse volume?
Normal?
Normal. Okay.
Yes.
You told me there is leukonychia or koilonychia?
No, doctor? No.
Nothing.
Nothing.
Proximal neuropathy?
No proximal.
Blood pressure sitting and standing?
Normal?
Normal. Any
Yes.
sweating in the hand?
Sweating? No.
Okay. You have any weight loss, Mr. Sami?
No, doctor. No, doctor.
How's your appetite?
Very good.
And any lumps or bumps?
No, doctor. No lumps or bumps.
Any night sweat or rising body temperature?
No, doctor. Never.
Okay. I will examine now for the face for any pallor in the eye or jaundice.
Okay, normal.
Normal. Okay. Any characteristic feature in the face?
No, doctor. Normal.
The arm span in the patient. Arm span.
Arm span normal.
Normal. Okay. I will open his mouth for. I will ask also for high arched palate.
No high arch palate. Mouth is normal. No central cyanosis.
Nothing in the mouth. Okay.
Yes.
Any elasticity in the joint, hyperelasticity or hypermobile joint?
No.
Nothing. The
Nothing.
skin itself, any skin change?
Normal.
Normal. I will ask for inspection the heart, the chest, sorry, inspection. Any
Chest,
scar?
no scars.
No scars. I will detect the apex
Apex normal.
in the place.
Yes, in place.
Any special character?
No.
Nothing. I will auscultate now. Or first I will feel parasternal heave.
Normal.
Loud P2.
Normal.
Okay, I will auscultate all areas, mitral, tricuspid, pulmonary, aortic. No murmur at all. Okay. I will check for fine basal at the back.
Normal.
Auscultate the back,
Normal.
both sides. I will ask him if he has tummy pain. I will press here in the semi-sitting position. I observe for raised GBP.
Normal.
I will examine the abdomen now by inspection.
Normal.
They're normal. Okay. Any by superficial palpation, any tenderness?
No tenderness. No organomegaly.
Okay.
Nothing.
In the face, any lump? Sorry, in the neck, any lump? Thyroid, I mean.
No.
I can offer him water to drink and I can observe for any swelling.
Okay. Normal.
Normal. Any lymphadenopathy?
Normal.
The legs now? Any leg edema?
Leg edema? No edema.
Okay. Okay, Mr. Sami, I will just summarize what we have been discussed. And if you want to add anything, please let me know. So you came with complaint of awareness of your heartbeat. It appeared 3 times. The last one was hours ago and it started 1 month back. It was associated with feeling short of breath, chest pain. Did you feel any sickness during this attack?
Yes, doctor, I feel fatigue, tiredness.
Fatigue?
Yes, during the attack only.
Okay, did you throw up?
No, doctor, no.
Okay.
Just I feel tiredness and shortness of breath and heart racing.
Okay. You want to add anything?
No, doctor.
You have family histories. Your father had heart attack before.
No, he said, doctor,
now.
I'm afraid of having heart attack like my father.
Okay. I want also to confirm that you are smoking 2 cigarettes per day, and you are drinking alcohol. Do you have any binge drink or excessive drink recently?
Yes, doctor, I drink alcohol in the weekend only.
And how many you are drinking at the weekend?
Yes, doctor, I think like 20 unit.
Okay, so I can still and advise you to moderate your intake of alcohol. It might be related to your condition. And if you need help, we can refer you to the special team for that. How does that sound for you?
Okay, doctor, thank you.
Okay. What are your concerns?
Yes, doctor, I'm afraid I have heart attack like my father.
I appreciate your worry and your concern, Mr. Sami. What you have, it might be, we have some possibility for heart attack. However, it's something else related to the heart, and it's related also to the alcohol intake. It might be related to it. For that, we have to run some blood tests to confirm this diagnosis. It's called lone atrial fibrillation. Lone atrial fibrillation means that it comes in attack and it goes by itself. And also alcohol, one of the triggers for these attacks. So we can tell you about this advice. We will include group of specialists and doctors. They can help you in this regard. Do you have any other concern?
Thank you, doctor.
How's the time?
Finish.
Okay, why you didn't
Okay.
remind me?
Because I like you, Dr. Basim. Your word
Okay.
is very good, really.
Okay.
Okay, Dr. Basim. What's your diagnosis?
Yes, I believe this patient might have lone atrial fibrillation. It's happened in attacks 3 times for the last 1 month. It comes and goes. Spontaneous recovery without any medication. The trigger in this patient, he's taking alcohol. He's a heavy drinker over the weekend. Apart from that, he's a smoker, but he's not a heavy smoker. In examination, I couldn't appreciate any finding. I tried to examine his heart. Everything was, I think, no more abnormality in his examination and finding.
Yes, doctor, what will you do to this patient?
Yes, I will arrange for outpatient clinic. Then I will do some basic investigation, basic workup like CBC for looking for anemia to rule out any anemia. However, he doesn't have any anemia signs or symptoms. Also for electrolyte, full electrolyte, along with renal function and liver function test. And also you will think about ECG and the echo. Before that, I could do thyroid function test just to rule out. However, he doesn't have any thyroid symptoms and signs.
Okay, very good, Dr. Basim. But what else?
Holter, I will arrange Holter for this patient to be
Yes.
done over 24 hours at home.
Okay, but the patient have attacks every 2 weeks.
Yes, we can do longer monitoring and observation. I cannot remember the name of this device, but it's same like the Holter. I mean, it can be prolonged for longer time, more than 24 hours.
Okay, okay, doctor.
I
okay,
can do also a stress ECG, a stress echo.
Yes, very good.
And if I suspect valvular disease, I can do MRI.
Okay, which type of this AF which has the patient?
It's paroxysmal AF.
Yes, very good. Okay, what is the cause of this paroxysmal AF?
Yes, sometimes
Patient was sleeping.
Yes, it might be. Yeah, I forget to ask about his mood and
The
his
mood is good.
Caffeine. I forgot to ask about caffeine. Yeah, so it might be triggered by alcohol intake. This is what's called
Okay,
non-AF.
but patient was sleeping. He woke up in the
Yes.
morning with the AF.
Okay,
So
so
what do you think about
yeah,
the trigger?
it might be long QT. I mean the genetic one, the inherited familial
Yes,
one.
it is one of the possibility. Okay.
Yeah,
Okay.
Brugada syndrome, also one of the familial condition.
Okay. Okay, doctor. What will you do you admit this patient in the hospital?
No, outpatient.
Okay.
Yes, only
I have.
outpatient clinic with the cardiology.
Okay, that's all question I have.
1
Thanks,
minute,
doctor.
sorry.
Yes.
Okay.
Thanks, Dr. Bas. You did it very well. And also my friend who did it in the exam like you did exactly and success, but he didn't reach the diagnosis. At the end, the examiner told him what will the patient was doing in the night. So he did in the night thing and woke up in the morning with his AF. What will
Oh my God.
yes, the patient told you that I wake up in the
Post
morning.
intimacy?
Post what?
Is it intimacy? Is it related to the intimacy?
No, no.
Sildenafil, something related?
No, doctor. No, the doctor will, if the patient told him what were you doing at the night, he tell you I drink alcohol much at the night and then sleep and wake up in the morning with this paroxysmal AF. So this patient is a syndrome called heart holiday syndrome. This syndrome, holiday heart syndrome. The patient drink a lot of alcohol at the holiday and then sleep and wake up in the morning with paroxysmal AF. Do you know this syndrome, Dr. Basil?
Of course, no.
Yes, it is a syndrome called holiday heart syndrome. This syndrome restricted only to alcohol. Patient drink alcohol at the night and then woke up in the morning with paroxysmal AF. It has many causes, due to hypokalemia, hypomagnesemia, due to alcohol itself. So if you go with me in with the examiner, told him due to alcohol, he will tell you, okay, what is the treatment of this patient? He will tell you about stop alcohol and
Cut
also
down, yes.
cut down alcohol, and also then the examiner will ask you, okay, what do you give this patient anticoagulant? So it is according Schätz-Vasco score, no need for anticoagulant. So this is the patient.
Okay, I Google it now.
Yes.
What's it? Yeah.
Very interesting case, really. I
Yes.
like this case,
See,
really.
Yeah, it's nice case, but see what they wrote. I just type holiday heart syndrome and in brackets they mention paroxysmal atrial fibrillation symptoms.
Yes, what is the causes? It is
Yeah, no, I mean it's paroxysmal AF in nature.
Yes.
Yeah, but if you mention to the examiner other than heart syndrome, holiday heart syndrome, he will minus you.
No, Dr.
That's my
Basim, I told
question.
you that my friend tells the examiner it is paroxysmal AF
Okay,
also.
then.
He
Okay.
success, full mark.
Okay,
Really,
I thought
full
it's
mark.
only should be till like holiday heart syndrome only. Okay.
Yes.
Okay, good.
No,
Yeah,
no,
nice case. Yes, nice case, doctor.
Very nice case. So the
Yes, I
patient
like,
wake up
yes.
in the morning, he woke up with palpitation and maybe also a supraventricular tachycardia or paroxysmal AF. So
Yeah.
you have to ask what were you doing before that? I will tell you I drink alcohol
Before the night, yeah.
before
Yes.
the night.
Before
Yes.
sleep. Okay, yes.
Yes, and
Agree.
this attack ends when the alcohol in the blood.
Yes, wash.
Yes, wash. Yes.
Okay, well, thank you for a nice case. A very interesting one.
Really,
by the
really, really
name.
interesting. Where is Doctor?
Yes.
Because what you told is that binge alcohol at the end. At the end.
Yes, I remember this question. Because whenever you think about paroxysmal and lone AFib, you have to think about alcohol itself.
Yes,
It's
but the
related
patient
to
was
alcohol.
sleeping, so no coffee, no stress, no anything.
Yeah,
Patient was
yes.
sleeping and woke up in the morning with
Yeah.
this AF.
And the caffeine also, I should ask about caffeine.
Yes, you don't ask about caffeine, yes. But he
Yes,
know. I
good.
mean,
Okay, good. Thank you, Dr. Mohammed. Nice case. Any comment on a question?
No anticoagulant for treatment for prevention.
no, we will
Again,
estimate
Chad's.
Chad's score. Any F,
Yeah.
even paroxysmal.
According to Shadvag score, right?
Yes,
Yes.
no, 0. He will be
Yeah,
0.
0 in this patient, but if he is diabetic, hypertensive, congestive heart failure, you will add accordingly. Then
Yes.
you will
The-
offer or you will give. Yes.
If the patient just wants to score more
Two and
than
above.
2 or more, even the patient has paroxysmal AF once, he will
Yes,
take
need.
anticoagulant forever,
Yes, he will.
even his
Yes.
sinus.
Yes. Okay, any question? Yeah, I like the comment by Dr. Marwa and Dr. Ryan. Bad dreams, yes, or nightmares.
What's your opinion, Dr. Besa, about this case? Very interesting, really.
Yes,
I like it.
nice. Sometimes they will bring to you find the patient without finding, and you have to examine everything. So I wrote in my paper, examine chest and
Yes.
pulse and chest and cardiovascular.
Yes, Dr. Basim, if you don't examine the chest or anything or the pulse,
Yes,
he
of
will
course,
minus
yes.
you.
The
Even
thyroid
it's-
also
the
consider
thyroid
as
also.
one.
It is very
Yes,
important.
one
Yes.
of the differential. Yes, you have to.
Mm.
Few chromocytoma in the differential hyperthyroidism, and our case here, paroxysmal AFib.
But you
nice
did
case,
it
Dr.
very well,
Mohammed.
Dr. Basim. You really
Thank you,
did it very well.
I will not ask you about marking because you are overestimating.
Dr. Basim, you know my mark for you. It is
Okay.
over satisfactory.
Yes, I know. That's why I didn't. Okay, Dr. Marwa. Oh no, Dr. Abdurrahman shared this page. This is holiday high syndrome. Wow. This is from Oxford.
Yes, from
Binge
Oxford.
drinking.
Yes, from
Yeah.
Oxford.
Yeah, it's a very small box. Down.
Yes, but you know, Dr. Basim, in your case,
Yeah.
what's your
But
opinion,
believe me,
Ahmed? Mahanna.
in UK, they are fair examiner. Really, if you give the diagnosis related to the
يا ابني انا
pathology, they
عمري
will.
ما سمعت عنه.
No, but it's not by the name. You can give the relation. any-
باروكسيزمال اف وخلاص.
Yes, that's it. Yeah.
Yes,
So you
if
can
you
think
told
about it.
but what is the cause, Dr. Basim? You told binge alcohol. You know, anyone, even me, I will tell you, okay, alcohol occasionally in the weekend, okay, no problem, like that. But you ask about binge alcohol.
Yes, you have to because you didn't find anything else, Dr. Mahmoud. I will not ask this deep question unless I didn't find others. No thyroid issue, no pheochromocytoma, no blood sugar, I mean hypoglycemia. So it must be like this, related to something intake or patient or iatrogenic, something you are taking from outside.
Yes, but Dr. Basim, really, my friend, told the examiner that it is paroxysmal AF due to binge alcohol. He gave him the full mark.
But Basim,
Because-
this report says that the type of arrhythmia in this holiday alcoholic syndrome is AF or supraventricular tachycardia.
Yes.
So
Yes, yes,
information
yes.
is the type of arrhythmia in this syndrome.
yes, it's
There is no
whatever. But why I said AF? Because he told me it's irregular, doctor.
I
So
told
according to
yes.
yes, yeah, according to his feeling, if he told you that I feel it irregular, so it's mostly AFib. If he told you no, doctor, it was regular, I will say sinus
I think
tachycardia.
Dr. Basim, in the case, really, in the really case, he told him that it is irregular because if the surrogate, the surrogate tell him that it is regular, he will panic anything, but
Yeah.
he need to concentrate to something.
Yes.
Mm.
So in holiday heart syndrome, it couldn't be irregular.
Yes, CVT or paroxysmal AF. he put in the case, the real case, it is irregular, to help you about find there is a cause.
Okay.
Mhm.
I
So
think
the
it's
pulse on the examination.
yes, you can say, Dr. Azhar.
So the pulse on the examination, it will be normal because it
Yes.
is paroxysmal.
Yes, but this one only Dr.
And
Azhar in the morning, only in the morning, not come in the
yes,
night, not come in the afternoon. Only when the patient wake up after taking alcohol at the night, he woke up with this paroxysmal AF.
and on the history, he will say, when I'm
Yes,
having attack, my pulse
yes.
is, I'm thinking my pulse is irregular.
Uh, yes, I told Dr. Basim the pulse was irregular.
Yes, yes.
Mm.
Thank you, thank you.
Maybe if I understood well Dr. Azhar, and I agree with him, it is difficult to tell as a patient that it is regular or irregular. So the safest way here, once during examination the pulse is normal, is to tell that this is alcohol-induced cardiac arrhythmia. Actually, this is what we used to name this. And as Dr. Muhanna, really, maybe I didn't hear about holidays that one, but it is well known alcohol induced. And you are right, Dr. Mahmoud. When you treat as normal. For example, the atrial fibrillation depends on the CAT score. But I think it will be more safer to tell that it is, unless it is mentioned, as you know, in the case itself that it is irregular, but unlikely.
Dr. Muhammad, whenever you have palpitation or awareness of your heartbeat, you have to know what was the reason. You have to ask him, or you can tap to him on the table, tick, 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 or tick, tick, or like clock, or you can
And I,
just, okay?
and I think the surrogate will tell you, Dr. Muhammad,
Yes,
about,
yes,
yes,
yes.
he will tell you it is regular. He will tell you.
Because they have been trained
Yes,
that if the
Yeah,
candidate
he
will ask,
should, because you reach to
uh,
this question, whenever you reach to this question, he should answer you. He will not hide. But if you didn't ask, he will not tell you.
yes, I didn't tell you, Dr. Basim.
Yes,
Even
yes, unless
he
you
told
ask,
me.
yes.
Yes, he
I
told
agree,
me.
I agree, yes. Okay, any comments?
I think that the management is the stop alcohol seriously. It may be resolve this
Sure,
arrhythmia, and that is
sure.
used by
Yes,
arrhythmia. And ask the patient it is irregular or irregular, as Dr. Basim said, or tapping the table above the patient and
Exactly.
ask him any misbeat, like differential diagnosis, ectopic beat it may be. So
Yes,
that
could be. Yes,
yes,
you're right.
that it may be a differential diagnosis, not a spot diagnosis. If it is, I don't know about this syndrome, I will put the differential diagnosis, atrial fibrillation, ectopic beat, and atrial fibrillation with the type of, so that I know that in the concern, this is related to alcohol that you're drinking at night. The first management will advise you to stop alcohol. It may be resolved completely. That is the induction,
Yeah.
no need, maybe no anticoagulant or beta blocker or something like that.
Yes,
yes,
you're right,
Dr.
Dr.
Yes,
Abdul.
Dr. Abdurrahman.
No, I think it is not a syndrome different than others, because as we know, atrial fibrillation can be induced by many things. For example, infection. So infection can cause atrial fibrillation. Also, they know one of the triggers of arrhythmia, cardiac arrhythmia or atrial fibrillation is alcohol, and related that to this. But it is the same like the other triggers of atrial fibrillation, and the management will be the same.
Yes, yes, sir. Read the underlying course. Okay, thank you. Any comment else? It's nice session, really. One
Yes,
case with a lot of finding and the other case with no finding, but positive only history.
yes,
Be ready, Dr. Mahmoud, be ready. You might have one case as acute and one as chronic. Okay, this is first thing. Second thing, be ready. You might have case with real finding, and the second case might be with no finding. The patient will be surrogate, but history finding only. Whatever the patient is having no symptom, sorry, no finding, do the all examination steps. Yes, you know he is a surrogate. 100% from his look, young man sitting with his clothes Mostly he is one of the colleague or the group of the doctors. He came and he said only for being a surrogate. So you will not find anything, but you have to do everything. Act like you are examining every system affected in the complaint. And if you suspect a condition like hemochromatosis, for example, what the hemochromatosis symptoms and signs? Liver disease and bronzing of the skin, and also the peripheral signs of
Darceresia.
hemochromatosis or chronic liver disease. So you have to examine these things. Whatever the situation and whatever the patient or the surrogate looks healthy in front of you, okay? They are judging on these steps, even the patient is normal. He didn't examine lymph node, minus 2 marks. He didn't examine the eye, minus 1 mark or whatever. Okay? So this is the last advice. And always write X as examination, what you have to examine before moving to the patient.
Mm.
Okay. Do you smoke? Do you drink alcohol? What's your job? Do you drive? Social history, family, travel, medical history, and surgical allergy and HIV. If you have patients suspected to be having a lot of disease from the complaint, please start by the what you are treating for or what's your medical
Complain.
condition. Not complain. What you have long-lasting disease I should be aware of. Sometimes Dr. Mahmoud?
Yes, sorry.
Okay.
Net in Egypt. Okay.
No problem, it's okay. Anticoagulant only according to the CHAD score. Yes, no. There is indication for anticoagulant. If there is possibility of having another comorbidity, you have to offer anticoagulant. Okay, any comment else? No, okay. Any question, any comment? Any comment, please?
Yes, not to you, Dr.
Yes.
Basim, but to the last of Dr. Musa. He
Yes.
mentioned there is no anticoagulation because it is induced by alcohol. No,
No.
there is anticoagulation
No,
because
he
Because
didn't
Chas
say. He didn't
No,
say
no,
no
no.
anticoagulant.
No, here just because he said because it is induced by alcohol, stop alcohol, and that is all. No,
no,
No, no,
no
no.
not like that.
anticoagulation because Chas first score.
Yes, I understand, but just
yes.
to answer him, so if atrial fibrillation without any cause or without caused by pneumonia, for example, or by alcohol or by anything, this is the same atrial fibrillation or paroxysmal atrial fibrillation.
Yes,
This is
yes.
the same.
This is 100%.
It is not only stop alcohol. Even
No,
if
no,
he
no.
doesn't want to drink alcohol in the future, he has to be evaluated under that score and see if it is
Yes.
2 or above to offer him anticoagulation.
Yes.
Of course. Yes, you're right. And we are agree for that. You have to refer or to mention the CHAD score. Of course, after referral to cardiologist.
And other thing, Dr. Basim, it is also, if the examiner asks about that, you will not stop in the GAD-VAS score. You have to also to mention that I do for the patient the has blood score, which will make you no contraindication for the anticoagulation. Some patients have
The elderly. Yes.
have high CAT-VAT score, but you will not anticoagulate because when you calculate the other score, which has blood score,
Bleeding
you will
score,
find
yes.
the risk of bleeding will be more, so it will be here the balance. So it will
Yes,
be
of
both
course.
of them, you will apply them.
Yes. This is for the elderly. Mostly in the elderly people, the frail people. Whenever you start CHAD score, you are judging and outweigh the risk and benefit of bleeding and thrombosis. And according to me, if he's frail, he has a lot of fractures, he has a lot of head trauma, all this will GI bleeding, all this will be considered as contraindication for anticoagulants.
The half,
Okay, Dr.
yes, it is hypertension. This is a H for hypertension. Okay. A, maybe the A, and the S is for history of a stroke. Bleeding, also any bleeding tendency or history of bleeding. So it is, this is a nomenclature. So you will get the score. If it is, I think above 3, I am not sure. You here will be high risk of bleeding.
Yes, Dr. We agree for that, Dr. Muhammad. Yes. Okay, Dr. Hatem asked, but it's caused by alcohol. No alcohol, no AF. So why because it comes in attacks. You don't anticipate what will happen in the future. If it comes again, it might carry risk of thrombosis, especially if he has left atrial dilatation, and he might have the stroke, and on time he will die. You don't know what will happen. So at least offer the anticoagulant, refer him to the cardiology. He will decide for the duration. You are not the one deciding for how long he will be anticoagulated. However, if someone can have the sure information for how long, but I think it depends on
Yes,
that condition.
yes,
Yeah.
yes. No, sorry. The duration, it will be like the paroxysmal atrial fibrillation. Once the patient has this paroxysmal atrial fibrillation and
For life, doctor, for life.
his score is above 2 and has a blood is less than 3, that means no high risk of bleeding. So he will be on anticoagulation for life, unless, for example, they did for him. This is paroxysmal AST, so he will be for life. And the other also, if it is persistent, also it will be for life. The same application for the normal atrial fibrillation.
Yes, doctor.
Induced or not induced?
Yes. Induced or not induced, just once for life. And
Yeah,
if the
lifelong.
patient sheds vasc more than 2.
Lifelong, yes.
Mm.
Okay. Okay, thank you. Someone wrote here the loop. Yes, I agree for this loop recorder. Yes, loop recorder. I think
Yes, it
more
is a loop
variation.
recorder. Yes.
Yes, more than the Holter. Yes. Thank you, Dr. Muhammad. Yeah, Dr. Muhammad. Thank you so much. Okay, thank you, everyone. Thank you, Dr. Mahmoud. Best of luck. Focus, relax, and sleep well. I think you will not join tomorrow, or you will join.
No, I think relax.
Yeah, okay. Relax, sleep well. Just focus on the exam. Train how to present a patient, and think about the steps of every examination. That's it. Don't read. Whatever you read now, it will not go inside. It will evaporate.
Yes.
Okay?
Praying for you, Dr. Mahmoud, and we are
Thanks.
expecting
Yes, of
you
course.
that
All of us
one
will
day
pray for
after
you.
the exam to join.
Sure,
Inshallah. And
100%.
we'll pray for you. All of us will pray for you.
Thank you, Dr.
Inshallah.
Basim. See you Saturday, inshallah.
Inshallah. Inshallah. Best of luck, Dr. Mahmoud. See you, inshallah, after the exam. We'll pray all of us for you. Any question from others before ending the session? Okay, if no more question, we can end the session. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you, everyone.